Hi there, it's Jeff Pierce from Michigan Sports and Spine. I don't even know anymore. It's week 14. So I want to do a big shout out to my daughter who's out in Colorado. Um, for those of you who don't know me that well, I've three children and I've just sent my second one to college, and it was a big emotional moment. She says she's watching right now, so I'm doing a major shout out to Paige. Who I just so proud of and all that stuff. So I won't get too emotional, but it was a great bittersweet weekend. Really proud. I mean, all of us try to raise kids and then you let them go out into the world, and hopefully you've trained them well enough to survive and do the right thing. And I think she's going to do an awesome job. So before I get emotional, I don't even know if she's on right now. If she is, she knows how I feel about her. So, getting into it, I'll get back into that emotional stuff later, but so I don't cry before we get started. We have a lot of questions. So what we're going to do, we mentioned it last week, and we're going to follow through with it, is we're trying to get more people to watch. We've gotten great feedback from the people who are watching, and we're giving good information, valuable information. And to be honest, it's really coming from your questions. So she just said, nice sweater. Thanks. I love you too. Basically, if we can push it out to more people, we feel that it's going to benefit more and more people. So if you can, share with your friends, all that through your social media. But we're going to start doing like little clips. We talked about stem cell today, which we'll get into later. But if you have any certain questions that we just want to highlight, we really appreciate it, because to be honest, I can sit here and talk forever. If I'm not answering your questions, I don't think it's really beneficial. So we do have a lot of questions today. Question one, we'll jump right into it. I saw that online you're certified as a pain management physician. Can you describe the different types of pain and when you should be worried? Shooting pain, burning pain, constant aching, stabbing pain. I ask because I'm pretty active, experience soreness occasionally, but lately more burning sensation in the center of my lower back. So basically, that's great. First of all, yes, I'm boarded in multiple things, including pain management. So, but I'm not one of the classic pain doctors where it's a pain clinic. We don't really advertise ourselves as a pain clinic. We have those tools, but we're actively treating everything. So when you ask about different types of pain, it's very important what we interpret. Like you're saying, shooting pain, burning pain, constant pain, all those things lead to different things. And when you have the shooting, burning, or the numbness and tingling, those become more concerning because those are nerve related. And if it's nerve related, it usually means it's more involved. So really to simplify it, we get down to what we call mechanical pain, which is more the musculoskeletal, the bony, versus neuropathies and nerve pains and pinched nerves and neuritis and all those fancy terms we use. Basically what we're saying is that there's nerve involvement. When there's nerve involvement, that's harder to treat, harder to go away, and you have to get on it a lot quicker. So you're mentioning that your soreness, you have to tell the difference. I usually tell people, if you've played any high school sports or any sports during your youth, you'll feel like early in the preseason that you're like, oh, it's sore, but you kept conditioning and it did well. If it's that kind of soreness, then that's going to be okay. It's a soreness of you not using it. Another big thing is we call it the CrossFits and the cross training. If you're used to I swim every day, I bike every day, I do something every day, well, now I'm doing this new workout and now I'm sore. That's normal because you're now using different muscles. You're doing different muscle groups. So we talk about muscle memory, we talk about muscle grouping, we talk about muscle conditioning and strengthening. I always want you cross-training. I always want you doing multiple things. Try not to just, I bike every day, that's it. I run every day, that's it. You have to do all the other things for full body fitness. And I've talked about multiple times about infrastructure. The better you build the infrastructure of your body, the earlier in your life you do it, is the better. Like I have my 13-year-old son. We had a big talk while we were in Colorado dropping my daughter off about the infrastructure, that I want him being broadening his workouts. And you don't do heavy resistance at 13, but you can do a lot of body weight, plyometrics, those kind of things. Build up speed, build up strength and conditioning, but also don't let your core or your spine or your posture. All those things are very good things to attack early. If you're doing it later, you're playing catch up for a long period of time. So to kind of get back to the question, you're having a burning sensation. When the burning sensation is happening, that means there's nerve involvement. We don't like that. So when your soreness went to burning, we always have to rule out, is there nerve involvement? And that's the most concerning thing. So, you probably need to be seen. If it's happening for more than 2 weeks, usually that's my rule. If you're uncomfortable for 2 weeks, it's not going away after 2 weeks, if you want to just take over-the-counter anti-inflammatories, do your stretching, and it's still not going away, you definitely need to get in and be seen. So, shooting pain, those are issues. Achy pain, that's more mechanical musculoskeletal. When you get the burning, tingling, and numbness, that needs to be seen right away. So hopefully that answers your question. You may need to have to be seen because a lot of times a hands-on examinations could be very worthwhile. Okay. So question 2, what's your favorite sport to watch? What's your favorite sport to treat? So I grew up in Hockey Town. My office is in the Troy Sports Center, sits over 4 ice rinks. So naturally, hockey would be probably my favorite sport to treat and watch. And it truly is. I mean, it's not that I'm not loving basketball, and everybody knows I have a lot of NBA basketball friends and stuff like that. Didn't really do a lot of the whole football. It's fun to watch. I like college a little bit more to watch, both basketball and football. Hockey, NHL, I've never really watched college, but the NHL has always been, my relationships with the Red Wings back then, I just have more of a passion for it. Treating those guys were easier. They're some of the toughest athletes that I've met. They really, their arm has to be falling off for them to stay off the ice. Even stitches, lacerations, 40 stitches on lacerations don't stop, doesn't stop these guys from playing. They can lose a tooth in the first period and they're back finishing the game. So the simple answer is I love all sports to watch. I'm even watching lacrosse. My son's got me into it. I understand the game a little bit more, but really the basics. I mean, probably hockey, obviously football, basketball, and baseball. Baseball, you gotta keep me awake for most of it, unless we're in the playoffs, which is most exciting. With our Detroit teams right now, it's not possible. So losing interest in that. Even with hockey right now, with the Red Wings out, which is just so weird in my lifetime to not have the Red Wings in the playoffs. I have patients that know my relationship with the Red Wings, and they're always asking, how are you doing it? I have one patient's like, you just have to pick another team and you'll fall in love with it. Right now, I haven't really picked a team to get into it. Maybe in the final rounds, we'll start watching it closer. To treat, I love treating all the athletes. I love treating young athletes. The younger, the better. I feel like a lot of times they get blown off that something's just going to heal on its own. That's not really what I do with young athletes. At that point, that's really where I start talking about cross-training and building their infrastructure, and a lot of them turned into great athletes overall. It's kind of funny. I've been around so long. When I first came out, I took care of a Little Caesars AAA, so our home ice was Joe Louis, and some of these guys have already have kids, and like, hey, Dr. Pierce, I'm like looking at him like, I don't really know you. He goes, you took care of me back in this year. I won't mention years, but it's a while ago, and it's fun to see that such an impact on kids, and you help me out and stuff like that. So it's the most rewarding thing that can happen. I enjoy it from all levels, from figuring out what's wrong to keeping them on the ice. Our motto's always been treat everybody like an athlete, and they need to be playing by Sunday. So hopefully that answers your question. Question 3. I was diagnosed with sciatica about a year ago. The pain down my side and leg would come and go, but I never really sought out treatment. I read an article that said stem cell may be good alternative for relief without the risk of having surgery or steroid injections. Looking for advice. So anybody who's watched me, or if you've been able to see anything we're doing, thing that's inspired me, especially since the radio show, is basically the the science behind the stem cell and the platelet-rich plasma. So the sciatica, I don't really like the term sciatica. Sciatica is a secondary term that means pain down the leg. That's usually a secondary problem. The primary problem is typically coming from your spine. And there's 5 levels in your spine, as we always pick up. You know, this is our lovely spine that I pick, and then my buddy behind us showing the full spine. But basically, again, this is the front, this is the back, this is the bone, this is the disc, these are the nerves. So when you're talking about the lower nerves, they all kind of form and create this big nerve called the sciatic nerve that runs through your buttocks muscle, or more specifically the piriformis muscle. Piriformis muscle is a muscle in the buttocks that will tighten and can irritate it. That's usually what true sciatica is. The problem with most people is that it's coming from your either lower segment, what we call the L5-S1 juncture, which causes that leg pain. And that's really what needs to be treated, because if you're not treating that, you're not treating the primary problem. If you just take care of the secondary thing and don't take care of the primary thing, you're going to be back, you're going to have risk of re-injuries, you're just not going to live a healthy lifestyle, and also you can start getting atrophy or muscle loss, which is a big thing, and people think I'm a little weird, but every time you need to check your buttocks to see if one side's not as firm as the other. And if it isn't, that really is a bad sign that you're starting to get muscle wasting, which is a big indicator. It's a red flag for us that needs to be treated more aggressively. So you need to take care of it. So if you're getting true sciatic, that's a problem. As far as treatment of stem cells, yes, there's a lot of treatment going on with stem cell. You heard me talk about all joints, all muscle tissues. We're putting stem cell and PRP. Again, stem cell is coming from your bone marrow, the biggest reservoir of undifferentiated cells comes from your hip. There's other places within the body to do it. They've talked about adipose tissue, your fat cells can produce stem cells also. I believe the best part is from the iliac crest, which again is your hip, to get the stem cells from. And there's also the PRP, again, that comes from your blood. We spin this down, we take all the properties out, and get a high concentration and re-inject it. So with the sciatic nerve, we don't really inject the nerve itself, although some are. They're injecting near the nerve, not into the nerve. I wouldn't suggest injecting into the nerve, but again, we need to determine if it's coming from the L5-S1 nerve root. We'll inject at that level. We'll inject in the spine itself. So if I go again, this is considered the nerve, this is considered the joint. What I'll do is I'll bathe the joint more because I'm finding more results with the joint itself. And within here is all these small ligaments. And within those small ligaments, we create a healing process, and we also get benefit to the nerve itself. There is what we say regenerative properties or healing properties for that nerve to kind of do better as far as the healing process, what I call the cascade of healing. The other thing we're doing, and a lot of doctors are doing it, is injecting the disc itself. So as you age, the disc shrinks, and as that shrinks, it closes off the opening. If it closes off the opening because it's shrinking, then you're going to have a problem of compression. You don't want that. So what's been going on now is you're putting stem cells into the disc itself, including adipose tissue, and expanding it or allowing it not to continue to deteriorate. Because once it deteriorates, and what people always say, I have bone on bone, which is very, very rare, that this space will continue to collapse. And you start noticing a difference in your height. When people are like, oh, I used to be like myself, I used to be 6'1", now I'm not 6'1" anymore, those areas you're losing your height. It's along with posture and losing the height, and you get what we call wedging. Wedging is changes of the actual structure of the spine, and you're going to lose height. So one of your indicators of a problem is if you felt like, a lot of people, you naturally age, you actually lose your height difference, but that's an indicator if you're getting it too early in life that might be a problem also. So I don't want everybody to start freaking out. Oh, I love the ladies who say, well, I was 5'4". I go, when's the last time you checked? She goes, when I was 18. And now they're like 5'2". I mean, there's a natural progression. She's 70 years old. But you need to be aware of what's going on. Working on your posture, working on your infrastructure, working on your core body. It's going to maintain your height also for years to come. So hopefully that answers your question. Just real quick, it can put off surgery if you need surgery. It doesn't sound like you need surgery. Steroid injections I've been doing for a long time. My theory now is that with the steroid, I'm cutting out the discomfort and then coming in with stem cell and PRP after to create a healing cascade. If you just go after it with stem cell and PRP to begin with, you're working too hard. You're working too hard to reduce the pain, and you're not getting all the benefits that the stem cell and PRP can do for you. So that's kind of my theory now, is to kind of bring it down with the steroids, but then hit it quickly with stem cell and PRP to create, again, that healing cascade and potential regenerative. All right, so number 4. Typically, how long is an appointment with you? Typically, that's a good word. So, how long is an appointment with me? Classically, right now, everything is a little bit different. So if you're talking about a telemedicine appointment, we have a system set up where my assistant will call you, kind of get all the intake information, and then I'll call you soon after. That soon after can be within 2 minutes to 20 to 30 minutes, depending on what's going on with the patients ahead of you. Classically, if you're coming here for a new patient appointment, we spend a lot of time. I really pride myself in spending a lot of time on that first appointment, because that's where I gather the most information. That's like, if you take the assessment, if you go from a sports medicine on the field, that's kind of how we take it. We spend most of our time seeing you as the acute injury happened. So even though your injury didn't happen that day, it's our acute moment, meaning this is our new onset, this is our beginning. So we spend a lot more time figuring out what's going on. We'll spend a lot more time asking the questions. We'll talk about things that you don't think matter, but I'm actually honing in on what I feel is setting up the treatment program. So the treatment program depends on how involved I need to be, how quickly I need to react. Like I said, there's things like red flags. When I made that funny comment about grabbing your buttocks and seeing if one side's weak. If I find that one side is weak and I've reproduced the pain and it's easy to reproduce and you're uncomfortable, you can't bear weight, those are all red flags that we need to get going right away. We need to get the MRI right away. We need to get the nerve test right away. We need to get treatment right away, potentially an injection right away, versus, it's a mechanical back pain. It hurts me once in a while. It doesn't really wake me up. Those are things where we can, okay, let's try this and see how you do. And 75 to 80% of the time, we're able to solve it right there with the treatment plan. 15 to 20% of the time, I need to continue to get the information. I need to get the MRI. A lot of times I don't need the MRI, but I need it for confirmation. Sometimes like I said, 10 to 15% of the time, I'm worried that maybe something else is going on. And when I say something else, it's not like, everybody goes to, oh, it might be cancer. It is something we think about. In my 20 plus years, those are the biggest things that I, potentially missed. So early on in my career, I missed the tumor that was they were having low back issues, but the tumor was in the mid-back. And I never thought to do the MRI of the mid-back until 2 months later. So, the symptoms continued to worsen, and we ended up picking it up, 2 months later, but we were treating it very aggressively. So now I know to kind of look for these things, and that just comes with experience. But we're so aggressive right out of the gate. So to answer your question, how long? Probably in an hour for sure the first time you're here. On the follow-up visits, you're anywhere from 20 to 30 minutes. But again, it depends on what's going on, how many questions you might have, how many details. If everything's going smooth and it's smooth, everything's going well. So it's not really answering your questions, but to summarize, it's probably about an hour for the initial and 20 to 30 minutes for the follow-ups, depending on if things are going as I planned or if we have to shift gears. All right. Hopefully that answered that question. Question 5. How do you motivate patients who are in a lot of pain? So I mentioned it, I think 2 weeks ago, that I get it, that when you're in pain, you're uncomfortable. Look, I deal with pain almost every day. I just came back from moving my daughter into Colorado. There's movement, there's travel, there's cars, there's different beds. So every morning I had to spend 30 minutes just stretching to get moving again. And I wasn't motivated, but I had to be motivated because we had things to do. So I mentioned, sometimes I'm real tough and I'm like, you need to do it. There's no excuses not to do it. We don't tolerate excuses. I get it. I mean, there's days you just don't feel like doing it, but I have to be the one who motivates you to do it. I have to give you like the light at the end of the tunnel type of attitude. That if you continue to not do what you're supposed to be doing, it's gonna snowball on you. And I always use the example: if I can catch that snowball at the top of the hill with the few tools I need, it's gonna be way better than midway or down the hill where I gotta use everything, including surgery. So the better we can be proactive and build our infrastructures and be preventative, that's really what I've pushed. Probably for the last, I don't know, definitely for the last 5 years, but for the last 15, since the day I started, it was more of a prevention program. I remember giving one of my first lectures, and we were worried about, is it preventative or prevention? And we fought over the terminology, and it's really both. From day one, it's like, I'm not here, I trained with a lot of smart doctors and everything, and I took what was good and bad from each of them. But none of them really pushed the preventative programs. It was more the alternative doctors, some of the therapists, that we need to do A, B, and C to get you out of your initial issue, but we don't want this thing coming back. And a lot of docs, they work off of repeat business. I've always said I'd rather get you better and you tell 2 to 4 friends, and that will build our practice. And that's really what's happened over the last 20 years, is that I'm focused on getting people better. I'm not going to agree with everybody. Not everybody's going to agree with me. Not everybody fits here. But the more active individual, like if you're thinking of Michigan Sports and Spine, and especially with our new doctor, Dr. Bonnet and Dr. Abrahamson, we're a team of doctors that are like, we want you motivated. If you're going to be motivated, we're going to go to work for you. We're going to work harder for you. We're going to take a personal interest in you getting better. And I do that. Like, some people laugh at me, like I really want to get you better. And they're like, well, why? It's kind of weird. It's people who are really trying, because it tests me. You're challenging me to get you better. And sometimes I teach a lot of my residents that don't think that people who aren't getting better, there's a certain type of physician that says it's on them. That's not the type of physician here. We have to be smart enough to figure out what's wrong. And the thing is, with some of the stuff we're doing, the cutting edge stuff with the stem cell, the PRP, Dr. Abrahamson's peptide treatment, there's more science coming out. And now with COVID, it's becoming even more apparent that we need to build up our immune system. We need to build up our infrastructure. Like the comedian says, I always say it, my son just said it over the weekend, I need to eat more dirt. And it's true, you have to build up your immune system. Like one of the comics says, if you don't build it up, if you don't train it, if you're just pure and sterile, your immune system's gonna be totally shocked when something actually happens. And there's so much truth to that. And to be honest, that's really what I do to try to motivate you. I try to teach you. I'm here to teach you what to do. I can't make you do it. I can't be at home with you. I don't want to be at home with you. I want you to at least take something from what I'm saying that motivates you. And a lot of patients, which feeds me greatly, is that I just had a patient come back after almost 20 years, one of my first patients. And she says, you weren't very nice then either, but I listened to you and it's kept me away from you for 20 years, but now I'm back. So, stuff like that is, hopefully that's considered a backhanded compliment, but to be, overall, I believe that we've been doing the right thing. We're trying hard, and we take the attitude that we truly want you playing by Sunday. So, long-winded, but to be honest, you have to be into what we're doing. You can't just expect us to pull the thorn out of your leg and everything's fine. We make you and give you education to take an active role in your treatment, and that's really what needs to be done. So to summarize, not all doctors are the same. We look for the warning signs. The good doctors look for the warning signs, not just for what exactly you're saying, but the whole body. Like people say, I got sciatic pain, and people are going to attack just the buttocks and the leg pain, where they're missing the whole problem that's coming from the spine. That's a big problem. You've got to treat from a holistic standpoint. You've got to be smart enough to understand what they're telling you, and then interpret and create the treatment plan. And the honest, athletes, I treat all athletes. I enjoy all athletes. I had a rugby player yesterday from college. Big guy. These guys are built differently. He had a muscle imbalance because his legs were so large, and his waist was, he's a good, strong guy, but he still, comparison, had a very weak core because of it. And that was probably from his overtraining. The biggest story I tell about that really quick was when we were at the training room when you had Fedorov, Eiserman, Brett Hull, and Shanahan. All four of them were lined up on the bicycles, and you could they're wearing these shorts and their thighs were just tremendously large. And to be honest, they're so overpowerful that it created muscle imbalance for their core section too. So they had to do alternative things to make sure they didn't have preludes to certain injuries. That's when all sports hernias were coming out because of the muscle imbalance. And the last thing, you never know what people are going through or who is in need of a little push. Be the reason someone smiles today. So that's a great way to end it. Nicole came up with that. She always yells at me I don't read her whole thing, but that's a sweet way to do it. Again, a shout out to my daughter and her new roommate out in Colorado. Peace out.